Thank you very much. Thank you very much for the invitation. And just for Dr. Pratap, I will make it in 7 minutes. At 3 minutes, I will save. So, as you know, stents nowadays are fine. There are a lot of stents, and the question is why maybe choose one over the other. And for example, I have only one stent in my lab. It's the Science, and now I'll try to demonstrate why you actually use just one stent, and then you're usually fine. So there's different topics we need to cover. First, we need to realize that stents are not perfect nowadays. So the results with stents are not perfect in the long term. Very often we are very pleased with short-term results, but in the long term we see that we still have continuous event in our patients. And there is room for improvement, and there is of course high-risk categories like diabetes where we really have to do more work to understand why and how to improve it. And there is of course the issue of neoatherosclerosis, which is an issue we have not resolved yet. Now, I think if you look at the drug-eluting stents, you have different components, and it's really important to try to please all these components in a way that we have good short and long-term results. So it's the drug, it's the coating technology, it's the stent itself, and it's the delivery system, because at the end you have to be able to deliver the stent. So to bring this all in a harmony can sometimes be very challenging. However, you can see that different companies have gone different ways in order to achieve this, and they have all had their reasons why to do it. So on the left side, you see the Science, where we have an 81 micrometer strut thickness. We have a PVDF polymer, and on the other side you see Zero from Biotronic, which goes with lower strut thickness of 61 micrometers, and then the maximum you have here with Nobor and Biomatrix, which go with 120 micrometers of strut thickness, which is significantly more than the previous. So now, why does one work better than the other, and is it really true that one works better than the other? If you look again at what we started in the beginning, you have the design of the Science stent, the multi-link stent design. Then you have the drug, which is now in basically a very well-established drug, Everolimus, and you have the fluoropolymer coating. So how does this behave and perform? Never change a winning team. So I think in terms of certain components like the drug dosage, this was established and it really didn't change. And I think this is a good sign, and it didn't change for a reason, because it works so well. And as well, the coating, this did not change. What changed was maybe the catheter technology. And yes, it's true that if you compare a Science from today and if you compare a Science from maybe 10 or 12 years ago, then you feel that you can deliver it a little bit better. But what didn't change was the backbone of which worked fine. Here you can see the comparison of the different stent designs and how this plays a role in terms of radial strength, and of course in terms of how much contact of the metal you have with the vessel wall. And here basically all four of them compared, and I believe that the Science stent has a good compromise between good or excellent radial strength and of course then very good longitudinal strength, and as well as a relatively low metal to artery ratio, because you don't want a stent which has so much contact with the endothelium that you cannot really cover everything. And on the other side you have the Zero stent, which doesn't really have a great radial strength, I have to say. I've used it in the past, and as well as the Onyx. Now, in terms of the polymer, there is also differences, and you will have the polymer, the stents with the biodegradable polymer, and the stent like the Science with a permanent polymer. And here, let's skip this because I think I will hit the time target from Dr. Pratap. Here, you will see that there is actually quite some difference in terms of thromboresistance and also in terms of inflammation and in functional healing, because you don't want a stent which causes inflammation and which attracts a lot of thrombocytes. And why is the Science stent such a, I think, good stent? It's because it attracts albumin. And if you compare it with other, then you will see that you have more albumin here, and this results again in less thrombocyte or platelet adhesion. So this means that this should relate to also the risk of stent thrombosis. And this high albumin binding is related to the lowest platelet adhesion. And there is different studies which I will show shortly, which demonstrated really that the healing is fast enough so you can afford to shorten your time of double antiplatelet therapy. The two studies, Science 19 and 28 days of DAPT, you see here, this was the study design, and now I will show you some results. So here's the primary endpoint of cardiovascular death, MI, stroke, definite stent thrombosis and bleeding in this trial. And as you can see, it's relatively low, and it is low because especially in high bleeding risk, you can see if you compare it like Science 90 and then the Science V USA study, you see the results are similar, although you have less duration of the double antiplatelet therapy, and you don't have increase of ischemic events, which was very important, because if you remember back some years ago, you were afraid to shorten DAPT, and very often we kept DAPT for longer than maybe we should have in these high bleeding risk patients. So the bleeding risk was clearly reduced, because we know the longer you have the DAPT, the more bleeding risk you have, so you want to stop DAPT at a early point in time. And as this is important to realize that at the same time you don't have an increase in stent thrombosis, so you can afford to shorten DAPT, not increase ischemic events. So there is now a lot of experience with the Science Stent, and it's performing very well, and this is the reason why in my lab I only have one stent, because I think this is all probably unique. There is a lot of studies comparing long-term patency and long-term efficacy of the Science Stent. This is data from Bern, Cardiobase registry, and you can see that actually there is signal that the Science could even perform better in terms of safety of stent thrombosis compared to stents with biodegradable polymer, which is a very important topic. And again, here you see in the long term, the stents actually perform quite well, and science performs well over years. So here I can show you also some other data which took this to a much longer time. Here you see even longer, and the performance even in long lesions and in left main is actually quite similar. So I will stop here, and maybe we have time for one question or so. Thank you very much.